Life support. So today's topic will be about basic life support, where I will be giving you a step-by-step guideline of what to do when you encounter someone who needs acute medical assistance. So we'll start by saying what exactly is basic life support. More commonly, it's known as CPR, and is actions performed on someone whose heart has stopped, aimed to buy enough time for them until emergency services arrive. It can be performed by medical personnel and anyone who has qualified in first aid. So how important is BLS? Well, several studies have been conducted and shows that BLS is extremely important in increasing survival rates of people who have undergone cardiac arrest. The UK ambulance services receive several thousand calls from suspected cardiac arrest. However, they are only able to perform resuscitation in about half of them, as patients have expired due to not receiving bystander CPR. It's that important. So what do you do when you see someone who could be having a heart attack? Well, first of all, you have to ensure it's safe to approach the victim and ensure bystander safety, no wires, any hazards, liquids, etc. Now, you start by assessing how the patient is. You shake them, you ask them if they're okay. If they do not respond, you do a sternum rub. That is, you get your knuckle and you rub the middle of their chest to evoke a response. If there is no further response, then we know that something serious may be going on and we start to look at the airway. However, if they do respond and the patient is breathing but they look a bit drowsy, stay at this side and observe any changes that may happen until the paramedics arrive. So we know that the patient is not responding to our cues. So what we do, we place them on their back and we open the airway using the head tilt or jaw thrust maneuver as shown in these diagrams. After opening the airway, we assess if the patient is breathing. We have to do this extremely quickly. This is a critical situation. So you look for any chest wall movement, you listen for any breath sounds and feel for any breath coming from the nostrils or mouth. A point here is that when a person goes into cardiac arrest, the heart has completely stopped, and it's important not to mistake the normal breathing someone gets with the agonal respiration seen in cardiac arrest. This is a survival mechanism kicked in by the brain. It's a brainstem reflex and occurs when there's a decreased perfusion to the brain. Call for help. This is extremely important. Just shout for help if you're on your own, and start CPR as soon as possible. How to conduct CPR? Well, we begin by assessing the position. So we place our hands over the center of the chest, about 2 fingers above from the xiphoid process or the tip of the sternum. That is where you place your palm. You also interlock your other hand and make sure that pressure is not applied to the ribs. You don't want to crack any ribs unnecessarily. It's important to make sure the hands are not further down, as it may cause the patient to vomit and aspirate, and the procedure is not effective if the hands are too further up the chest wall. So we have to start the compressions now because the patient is not breathing and not responding. Now it's important to make sure when you are doing compressions, make sure your shoulders are directly above the site where you are pressing. You are pushing with your body, not your arms. If you push with your arms, you will get tired very quickly, and that will not help anyone. So you press down with a depth of 5 to 6 centimeters. No one really assesses how hard, and no one really measures the depth of which you're pressing, but you get an idea that this has to be quite a lot of pressure applied to the chest wall. So this is done at a rate of about 100 to 120 per minute. Rescue breaths. Now you should only give rescue breaths if you know how to. If you do not, just continue giving CPR. So after 30 compressions, you give 2 rescue breaths. You tilt the head of the person back, opening the airway, pinch the nose, form a seal with your mouth, take a breath in and blow into the mouth, watching for chest movement and each breath takes 1 second. Do not interrupt compressions for more than 10 seconds between when performing rescue breaths. If you are not trained again in giving rescue breaths, continue with the CPR. If a defibrillator does arrive and you know how to use one, do use it. If there are more of you over there, one person attaches the electrodes to the patient's chest while the other one is still performing the compressions. Do not stop. Do not stop until the patient regains consciousness, which by CPR alone is quite rare. Recovery position. If a patient, however, does regain consciousness, then it's good. You have to place the patient in a recovery position. Now, this recovery position, what you do is with the patient lying down, you raise one of their arms up as if they are waving to say hi. Secondly, you place the other hand on the opposite side of their face. And with that, you bend their knee and you tilt them towards yourself. This is the recovery position, and do make sure that the head is tilted back so it's easy for them to breathe. This is the recovery position. Here are the references, all the information that I have gathered, and that is a quick guide on how to perform CPR. Thanks again for watching, and if you do have any questions or comments or any suggestions or any topics, please do leave them in the comment section below. Thanks again.